Assalamu alaikum, Jamian. First of all, I would like really to thank Mr. Organizers for giving me this chance to share with you about Jordan. So first, I'll be talking facilities that we have and our future plans. According to the Glucocan 2020, we'll be having around 11,000 new cases. And we do have National Cancer Registry that's back from 1996. And the latest report, 2018, we have around 9,000 cases. 6,000 are Jordanian and 3,000 are non-Jordanians. And the most common cancers in male and female, you can see here as expected in for male lung, colorectal, bladder, prostate, and leukemias, and for female breast, colorectal, thyroid, uterine tumor, and leukemias. Now, just to share with you some history about radiotherapy in Jordan, actually the first one who introduced radiotherapy practice in Jordan, and he was Dr. Abdurrahim Malhas. He came from Nablus in Palestine to Jordan in the 40s, and he established in the 1945 the first private hospital in Jordan. And at that time, he bought in late 50s one machine, 5200 to 100 kV, and he started treating superficial tumors. So that was in late 50s. And then he donated this machine actually to the Ministry of Health in 1962. At that time, there was no any single radiation oncologist. And then after that, Al-Bashir Hospital, which is the largest government hospitals in Amman, Jordan, they bought another machine, ortho voltage machine, which is 300 kV Maximal, and they started treating the tumor, and again, by either radiologist or nuclear medicine physician, but there was no any single radiation oncology. In 1967, they got a Cobalt machine, the first one. And then the first radiation oncologist who came from the US trained, Dr. Khalil Al-Khatib, he was the first one to start the practice of radiotherapy from 72 to 74. And then he left back to US. At that time, the IEA hired a Polish radiation oncologist to come to Al-Bashir Hospital to run the practice of radiation oncology. And the Department of Radiation Oncology was created in 1978. It was under radiology and nuclear medicine. So 1987, the 78, the separate radiation oncology department. And in 87, they put the LINAC machine. And so that time, so LINAC and the Cobalt. The first residency program, radiation oncology in Jordan, was in 1987. And in 1992, the Radiation Oncology Committee, which is under the Jordan Medical Council, was created. Actually, before that, between 87 to 92, some of the examiners, they were either radiologists or nuclear medicine, but there was no any specific examiners for radiation oncology, but it was there from 1992. Now we do have 3 residency programs, one at the government hospital, Al-Bashir, and at King Hussein Cancer Center, where I work, and at the military hospital. The golden era of radiotherapy actually in Jordan started in 1997 after the establishment of King Hussein Cancer Center, being the only comprehensive cancer center in Jordan. So we started with the 2D brachytherapy with the HDR, mainly for gynae cancers in 1997. Then 98, we started TBI and TLI. In 99, we started total skin irradiation. Again in 99, the SRS and SRF. And then 3D, we moved in 2005, IMRT in 2011, the extracranial SBRT in 2015 for different sites. And the prostate, actually, SBRT was started 2 years ago. The VMAT and the CBCT IGRT was started in 2007. And we really utilized so many MOUs and agreements with different well-known cancer centers in the world to try really to develop these techniques back from 1997. Now, the residency program at KICC, which we started 2004, and I was really honored to be the founder and the first director of this program. And actually, by this, we could build our team in radiation oncology because we had a severe lack of the well-trained radiation oncology at that time. So far, we graduated 53 residents. Jordanians are non-Jordanians. You can see here 37 Jordanians. Most of them are in Jordan. Some of them left to the UK and the US, and non-Jordanians 16 from Palestine, from Bahrain, Iraq, Kuwait, and Yemen. I'm really happy to see some of our graduates actually from Arab countries. They are doing great in their countries, and some of them are head of departments in their countries. Now we have a big, really, team of family of radiation oncology with well-trained medical physicists, RTTs, and the physicians. So we really overcome the problem of the severe shortage of the staff by developing our own residency program and also sending our graduated residents to UK and to Toronto in Canada for 1 or 2 years fellowship programs. So we published this about how really in a developing country you can successfully develop a high caliber program of radiation oncology residency program. So if you see the facilities in Jordan, we have 4 radiotherapy facilities in Amman, the capital, and 1 in the north, which started a few years ago, just 2 or 3 years, in Erbil, that's northern of Jordan. And also we are now having a satellite small cancer center in the Aqaba city run by the King Hussein Cancer Center, and this is actually our future plan. 2 phases. The first one will finish next year, and then radiotherapy will be added to it 2 years from around 2026. Now, regarding the machines in Jordan, we have 5 radiotherapy facilities, as I mentioned. We have 18 linear accelerators, 7 simulators, including 1 MR, which we just started or under construction. It's almost done at King Hussein Cancer Center. We'll be having 1 MR sim and MR Linac. And we have 3 brachytherapy HDR units. And you can see they're distributed in these cancer centers facilities. Manpower, we have 46 consultants, 29 residents from different countries, 73 RTTs in general, 5 radiation protection officers, 2 of them just radiation protection officers. They don't do anything else. But in other 3 facilities, we have them as being medical physicists, and they do some job of the radiation protection officers. And we have 60 nurses. Among them, at King Hussein Cancer Center, we have 18 coordinator nurses that they work with the radiation oncology consultants, and really they are doing a great job in that terms. Now, these are the distribution of the manpower at the different facilities, as you can see here. Gamma Knife, we have 2. The first one in 1997 at a private sector Ibn Haytham Hospital, and the second one in 2022 at Jordan University Hospital. We also published this in JCO Global Oncology about the history of radiotherapy, starting from late 50s till today, about all the facilities and how we could really overcome the problem of the manpower, whether we are talking about radiation oncologists, medical physicists, or the RTTs. Now, we do have a very strong relationship with international societies, including the IAA, including the ASTRO, the ISTRO, the ASCO, the ICC, and we have leading roles there and leading positions as well. So with the IAA, last year, we signed an agreement considering KICC as a collaborative center, And just 2 months ago, we signed an agreement as an anchor center. There are only so far 5 anchor centers in the world with the IEA. So we'll work with the IEA in the fields of radiation oncology, nuclear medicine, radiology, and nutrition as well. And we also, with the IEA, we developed a 2 years residency program, medical physics, because we know that there is a severe lack in the well-trained medical physics in the Arab world. So we started that, and that's in conjunction with the Yarmouk Hospital, Yarmouk University, one of the universities in Jordan here. And the curriculum was really developed between us and the IEA. So this is the signing ceremony, last year, considering KSSC as a collaborative center, and this 2 months ago only, again, considering KSSC as an anchor center. We do have many activities with the IEA. This was in January 2023, IEA regional course in radiotherapy physics quality assurance, and we also signed agreement with ISRO to have 2 every year to have 1 ISRO course in Georgia. But this time we decided with them for 4 to have 2 parallel one for medical physics and 1 pediatric oncology. And really, I encourage all of you, and hopefully we can do it in February, because we are confident in the region, but hopefully we can do it. We provide also many 1 to 3 months short training courses for many manpower in the region, also from different countries in the latest technology. And these are some of the courses that we do have. The King Hussein Cancer Center, we are a reference site partnership with Electa, and these are some of our trainees from different countries indeed. And now King Hussein Cancer Center is being a hub for training you can see from different countries. We have signed MOUs agreement with different countries, not only from the Arab countries, but also Romania, Ukraine, Afghanistan, and other countries, Uganda also in Africa. So future direction, we will be having the new radiation facility in Aqaba in the south, 2 or 3 years from today. And also we are providing more and more technical capacity building and training for different healthcare providers in cancer in different countries, not only in the region, but beyond the region as well. And the question, the hot topic in Jordan, should we have in Jordan being a country with a constrained economy, should we really go for hormone therapy in 5 years from today? Thank you so much.